the only ones, and by that I mean Ted, who wants to stay young forever. Millennials who can't imagine getting old are lining up to get preventative Botox and fillers to stop those wrinkles from ever forming even.
Joining us on the Kogo News Live line is board-certified plastic surgeon Dr. Farah Khan. Good morning, doctor.
Good morning.
So millennials getting preventative Botox and fillers. Is this a good idea?
Sure. It's, there's really, these are non-invasive procedures. So the downtime is really minimal. You obviously do want to go to someone who's a board-certified plastic surgeon or dermatologist so you don't get bad results, but there's really not a lot of downside. If you start getting fillers and Botox in your 20s and 30s, then the thinking is you won't necessarily need to get a facelift or, a bigger, more invasive procedure as you age.
Now, is it true?
Well, it does help. Botox we've seen when people typically get it for 3 or 4 years, pretty consistently every 3 months, I've noticed that they don't need it as much then. And so they can go 6 months or 9 months without getting it. And eventually they really don't need it. So, it really does help prevent some of the, more drastic procedures that people need then when they turn 50 or 60.
So here's the problem, though. All right, once you start getting the Botox, the fillers, and all of a sudden, let's say you can't afford them anymore, aren't you going to start to sag?
Well, that would be an issue. You're right. I think you do need to maintain. It's just like anything else. It's like working out. If you work out consistently for a year and then stop, you're not going to have, the same great results that you did.
All right. So let's say you're starting in your 20s. What's the best thing that you can do to try to stave off aging? Is it going to be a filler or is it going to be Botox, maybe in your forehead or something?
Sure. I would think the majority of 20-year-olds would probably benefit from Botox because we're so expressive. And I think as a society, we tend to raise our eyebrows. We kind of scrunch our faces. So we tend to make kind of those frown lines relatively early on. So that is definitely something we can benefit from. Fillers, typically, I would say women or even men probably in their 30s, because that's when we actually start to lose volume in our face.
But how do you keep from getting have you seen the chipmunks, the women and men who walk around with the big, huge cheeks, and it's like they filled so much that they didn't know how to stop?
Yeah, and I think that's why it's really important. I can't stress this enough. People really need to go see a board-certified plastic surgeon or dermatologist because the problem is there's so many people out there doing fillers and Botox who really weren't trained. And so they do overfill. And, when I see a patient, for example, for, the lips, we never inject more than one syringe in the lips just because, otherwise you give them duck lips. And that's not a very good look.
And if you get a bruise, it's Hitler the duck.
Yeah. So you need to obviously find the right doctor, right surgeon, whatever, who's going to do the procedure, and not just go to, the shop in the mall.
Oh, boy. All right. So what is your best advice? Well,
I think, if someone really does want to get Botox or fillers, I think go for it. I think the best piece of advice I can give is definitely research whoever you are going to. Make sure that you see their before and after. Make sure they are board certified in dermatology or plastic surgery because those are the people who are trained to do it.
All right. Dr. Farah Khan with us here on the Kogo News Live line, a board-certified plastic surgeon. And it looks like people are starting younger and younger to try to keep from aging more or earlier.
Exactly. Yeah.